Yes. Good evening, everyone. Thank you so much for joining us today. We are back with a very interesting topic this time. A kind request, please. I've muted all, but if you can actually mute and stop your videos so that it doesn't disturb the presenter. I love. Yeah, I've muted everyone so that you won't get disturbed in between, the webinar. Yes. Okay. Good evening, good morning, everyone, wherever you are. Thank you so much for joining I Love Homeopathy webinars. We're planning and trying as much as, giving a very frequent webinar almost every week or a month, at least a webinar a month, so that we are in the same track and we're not, sidetracking elsewhere. But we appreciate everyone. I see so many familiar names today, and I appreciate everyone who's stuck along with I Love Homeopathy as a family, and people who are new to the webinar. I welcome everyone. We have Ontario College today. They present a webinar every month, and it is just a pleasure to listen to them. You always be in your tip of your seats, learning a bucket load of knowledge every month. Every month they come with new topics, and uh, it just surprises me, how much I could, learn, how much homeopathy gives back to me. And I wish everyone takes back the same amount of, knowledge back after the webinar today. And I don't want to waste for much of their time. So yeah, I'm muting myself and I'm going off. On to you. 1 second, I'm sorry.
How's that? Can you hear me
Okay,
now?
I am sorry. When I actually did, try to mute everyone, I by mistake I muted you both as well. I'm really sorry. Yep.
No problem. Well, thank you for having us once again. And today we will be talking about the role the Poalis family of remedies has on allergies, specifically seasonal allergies, because we're entering in the Northern Hemisphere anyway, we're entering a time of year where allergies are running rampant. And so I will talk about allergies, and Beth will talk about the Poalis family and introduce some remedies that maybe some of us are not all that familiar with and how they play a role in treating this very common condition. So allergies is very basically an immune hypersensitivity reaction to substances that are usually quite harmless in the environment. And there can be many different types of allergies, including hay fever or food allergies, allergies that might affect the skin, allergies that might affect the lungs, and of course the most dangerous type, which are anaphylactic allergies that people rarely have, but they can be really quite intense and life-threatening. This time of year, we see a lot of pollen in the air and patients who are coming to us with hay fever as well as allergic asthmatic symptoms. They they present with many variety of symptoms, including itchy and red eyes, a rash perhaps on their skin, sneezing, runny nose, shortness of breath and swellings, and a decrease of smell or taste. So the Poalis family that Beth will further discuss later, just keep that in mind with all of the watery sort of discharges that we see in our patients. It's a key indication for this family of remedies. And these nasal discharges, of course, they can be described by our patients in many ways, including that they may be bland or acrid, or they might have itchiness in the palate, or the discharge itself might be itchy on the skin, and it might affect other parts of the nasal mucosa, as well as the ears and the mouth and the throat. So we do see a lot of different um, pathological expressions in our patients. Now, allergens, are everywhere in the environment around us. They could be ingested or inhaled, or even enter through the skin. our bodies produce antibodies, which are specific to allergens, or IgE antibodies, and they're produced by the immune system because what happens, and we'll go into this in a minute, is that our body recognizes a certain allergen as harmful, even though it might not be to the majority of the people, and it produces a reaction. On subsequent exposure of this allergen, the antibodies that were previously produced can release substances like histamines that cause these allergic symptoms. So it's not a one and done. Allergies can be certainly be chronic and come up for people numerous times over the course of a season. The sort of common allergies that we see in patients in our practice include pollen and dander, dust mites, which are very common in mold, which is completely insidious. Foods that they might be allergic to are fairly common allergens like nuts and wheat and soy, eggs and milk, and fish. Many people are allergic to insect stings or different types of medications, and skin irritants like latex gloves. So our patients, of course, because homeopathy is an individual treatment plan, they express their symptoms in a variety of ways. And oftentimes the way they express their symptoms might have something to do with their heredity, for example, or their sex or race or age. Oftentimes our bodies might be suppressed and not show symptoms, and other times the allergic response might be really, really great. Now, the allergies are also expressed depending on any kind of infectious disease exposure to childhood, or they might be exacerbated through environmental pollution or dietary changes. Allergies are elusive, and it's kind of difficult to understand how they present in people because it's not always the same. Dietary changes might affect it. So is there a way to know what someone is allergic to? Of course, there's testing. There's a topical dermal testing, but that's not all that reliable. And diagnosis is a challenge. Sometimes there are different types of therapies that might be beneficial, like immunotherapies, for example, that are given from a young age to desensitize the body. But ultimately, we see this in practice and we need to be able to deal with it. As we mentioned previously, we could see allergic reactions to many areas of the body, and here are some that are listed. But treatment plans are not as effective, of course, as homeopathy, and we're biased, but treatment plans include the avoidance of allergens, which becomes challenging, especially if the allergen is environmental. It could include the administration of steroids to suppress the allergic reaction, or antihistamines, immunotherapies that we discussed to try and prime the body, or desensitize it in the long run. And in more serious conditions, we would also see patients taking epinephrine, so in cases of anaphylaxis, for example. Now, what happens to the body in an allergic response that is acute? Well, as soon as the allergen is detected by the body, the immune system responds with the T2 cells. The T2 cells interact with B cells, which produce antibodies, as we've mentioned, the IgE antibodies. And these cells are sensitized to the allergen. So the next time this allergen is or we're exposed to it, or we feel it somewhere in our body, this sort of base primer that has been initiated activates the sensitized cells, causing what's called deglutination. And they release histamine and other inflammatory chemicals to the surrounding tissues. And that is how we see this inflammatory response in our patients. We see things like a runny nose, itchiness, swellings on the skin, difficulty breathing, and the worst possible reaction, of course, is an anaphylactic reaction. The symptoms can absolutely be systemic, or they can be local. And that's what we need to take into account when we're prescribing. So that is an acute phase reaction. What happens in the long term? There is a late phase response that our bodies participate in, and it's basically after the chemical mediators of the acute response subside, then the late phase response occurs. So other types of white blood cells migrate to the initial site of the reaction within 24 hours, and sometimes we see longer term effects like asthma. Now, we talked about very briefly acute versus chronic or late stage reactions, but there are also acute and chronic allergic reactions that we need to consider as homeopaths. Oftentimes, we treat acutely because the patient is in desperate need of help right now, and so giving an acute prescription is very beneficial. Of course, we want to look at the symptoms of an allergy as an acute expression of the chronic state. And this approach sort of involves palliating symptoms with homeopathic remedies because of the immediate exposure versus a more chronic prescription that will deal with the patient's overall state over the course of the year so that they will not eventually have those acute allergic reactions. The chronic treatment must be done throughout the year, not necessarily during the acute phase, which results in the gradual diminution of symptoms over time and a loss of the allergic reaction altogether. The chronic treatment, of course, addresses the entire person, mind, body, and emotional state, and not just the acute symptoms therapeutically that we would treat in an acute state of an allergic reaction. And we often use more constitutional type remedies and no-sodes for the chronic treatment of allergies. So with that in mind, the hay fever and rhinitis that's coming up this time of year is one that we will consider. These symptoms absolutely range from annoying for some to completely debilitating in other people. And rhinitis and hay fever are typically a reaction to what we find with plants and trees emitting their pollen and fungal spores into the air. It is an inflammation of the nasal passages, which leads to sneezing and discharge and nose being stuffed up. And when we look at these symptoms, we have to keep those in mind in order to prescribe appropriately. And so now let us go into the Poalis family. And Beth, take it away.
Okay, thanks, Harula. That was a great introduction. When I got on, Dr. Ramishka said to me, why did you do this? Why are you coming up with a specific family for addressing allergies? And as I said to her at the time, one of the things that we're trying to do on these webinars is introduce people to some new ways of thinking. Many of you are very familiar with the very common remedies for addressing particularly acute hay fever, the euphrasias, Allium cepa, pulsatilla, those sorts of remedies that are so effective in the acute phase of treating hay fever and seasonal allergies. But I think it's really important for us to keep homeopathy alive and to keep looking at new and exciting and different ways of addressing situations, thinking about things and learning about new remedies. And so with that in mind, I wanted to introduce those of you who are not previously familiar to the Poales family of plants. The Poales family is also known as the Graminées. And I believe that the Graminées is the terminology that Scholten and Sankaran use in their schema. But these terms about plant families are very technical. They change over time. And I refer to this group of grasses, and the Poales are monocot plants, and all of them are grasses. And if we start even just for a moment and think about this idea of like cures like. And we think about the causation of seasonal allergy, which is almost always, something, the spores and pollen from that which comes up in the springtime and through the summer and autumn. Grass is a huge part of that picture. In fact, they call it hay fever for a reason, because it is that kind of allergic response to hay, which is also known as Timothy grass. Although, to be fair, there are a large number of grasses that are grown for hay. So Timothy grass is only one of those, of the many grass plants that are used for hay. So poales are a very economically important order of plants. They stem from everything from bamboo is in the Poales family, saccharum, which is sugarcane, is in the Poales family, hay is in the Poales family. So and wheat. Wheat is probably the most economically significant of the plants that are within this family grouping. Yes, I included also our barley, maize, millet, rice, and oats are all part of this family. I mentioned sugarcane before. Lemongrass is often used. So this is a huge family of both they're used ornamentally sometimes in the but at this point, largely they're edible grasses that have a huge role in sort of feeding people and keeping economies alive. So these grasses are typically dominant in open habitats like prairies and savannas, and they also therefore form a large portion of the foraging for grazing livestock. So even when we are not eating these grasses directly in forms that are familiar to humans, like millet and rice and barley and wheat, we're eating them through some of the livestock, if those of us who eat meat, livestock who eat these grasses and fatten themselves up on these grasses. And of course, in the West, we see a lot of them in lawns, and the lawn care is a huge industry. Keeping lawns green and weed free and looking pretty is extremely a big industry in certainly the suburban, urban suburban areas. So there's interesting reference to the suppression of allergenic flowers in the horticultural realm. So these plants are used in the homeopathic world to address other things, common allergies. And these plants, these grasses, are used horticulturally to suppress the growth of other allergenic flowers. So even in the horticultural realm, there's this interesting relationship between allergenic plants, and these grasses. In botanical history, the poales evolved with the rise of mammals following the decline of the dinosaurs. So we're talking about being around for a very long time, creating low grazing pastures that provided nutrition, already mentioned. And these grasses and grains ultimately facilitated the transition of human beings from hunter-gatherers to the more sedentary life of villages and agriculture and permanent settlements. There wasn't the need to wander, as grasses became something that could be cultivated and then used for human consumption, cultivated and used to keep livestock in a given place. So the grains have altered humans' ability to reproduce, to transcend nomadic existences, and enable the formation of human settlements in ever larger villages, towns, and cities. And therefore, it is no surprise that some of the overarching themes of this family of remedies, when we think of them as medicines, include nutrition, nurturing, stability, and connection to roots. So it's very interesting how we see that pattern already established in the actual history of the botanical family. So the sensations of the remedies that fall into this order of plants include burning, stabbing, tingling, along with this feeling of instability, the need to stand tall and strong, the need to be self-supporting. So in Sankaran's plant classification, the Poales are known as the Poaceae segment or subfamily of the Gramineae order. So sensations associated with the Poaceae grasses, and I'm using Sankaran sensation method here now, are stinging, pricking, thorny, tingling, piercing. So give a moment here and think about these sensations in relation to people's common complaints about allergies, seasonal allergies, environmental allergies. The pathologies that are common to this order of plant remedies are all around nutrition, around excess fluid, around, excuse me, around kidney and urinary tract pathology, around allergies, back, food sensitivities and allergies, and disorders of the mucous membranes. And again, it's very easy to see within these patterns how allergies can easily fit in. So I want to talk about the family of remedies in a larger perspective. The remedies we're going to talk about today have very, very broad picture. And allergy is a big part of all of these remedies to a greater or lesser extent. Most of these are not remedies that I personally use in acute addressing of allergies or allergy states, although not exclusively. There are some of these remedies I have used in the acute expressions of allergies, but they're really, really important remedies to think about for, Harula just talked about the chronic versus the acute treatment of allergies. So if you're treating allergies as a chronic part of a chronic condition, you're going to be looking for more than the presence of allergies to understand the larger chronic picture. So if you have a case that has a lot of allergies, but also has the themes we're about to talk about now, it behooves you to do your research, to start reading up and thinking about the Poales family for addressing this chronic state. There are remedies, and we're going to talk about one or two of them. One of them I actually have a note on, and I didn't include in the slides, but I'll write it into the chat, are very, very useful in acute addressing of allergies. And I believe that's partly just because we don't have a large enough understanding of these remedies to understand how they would be applied chronically, of the two remedies I'm referring to acutely. So the mental emotional themes, and I talked about the general themes of nurturing and stability above, but the more specific mental emotional themes in this family of remedies include parental nurture and connection or disconnection from family, roots, and place of origin. Another important theme is early responsibility for the family. Excessive or deficient giving, addiction, and obsessiveness. So being at the center of as the provider or as the recipient. So in other words, giving too much or taking too much. So this is what I'm referring to by excessive or deficient giving. Supporting or being supported. We see this theme of balance issues in terms of giving, taking, providing, and dependency. But we see balance also on the physical level with issues around stability and back pathology. So there's a difficult balance between being nurtured and nurturing others that we see present in most of these remedies. That can often be expressed as an unreadiness for motherhood. It can also be expressed as sexual organ or hormonal pathology, and which is another way when there's a lack of sexual organ development, hormonal pathology that prevents that ability to reproduce, to nurture, and continue that cycle of nurturing and giving. Another important theme in the Poales families is strong loyalty in relationships. Any breakup needs to be avoided at all costs, and which results often in very unequal relationships in which the person in the relationship who needs the Poales remedy is doing all the work. And we can look back to some of these other ideas we've presented. That's that idea of excessive giving, being at the center as the provider. They're doing more than their share. And these people tend to enjoy alcohol as a break from the routine stability of their lives. And that you note that many alcoholic beverages are brewed from Poales grasses, beer and whiskey being very good examples of that. So these remedies are often useful remedies in addressing children and adults with symptoms of ADHD. In the chronic picture, there's a lot of hyperactivity without chaotic behavior, just busyness, a lot of restlessness. There's a great deal of ambitiousness. So they set high goals for themselves. They're power hungry. There's a lot of jealousy. There's asocial behaviors. There's desire among children to be more like adults. There's this sort of idea of tactical manipulativeness to win over others, to control situations. These are children who tend to be inconsiderate at home, pleasing others at school. And I'm telling you all of this because these are remedies that I have found to be extremely useful in children with ADHD and a strong allergic picture. I just want to say that children with ADHD and a strong allergic picture is a strongly tubercular state. And we do see a lot of allergies in children with ADHD. And there is that tubercular miasm at work. And I think that a lot of these remedies, a lot of the Poales remedies would fall into the tubercular miasm. So I want to look here at a few remedies. I'll read through these remedies with you. We can talk about them a little bit. The first remedy I want to talk to you about is called Arundo Mauritanica. Now, Arundo is a remedy that I do use in the acute treatment of allergies. There's tremendous itching just inside the nostril or deep in the nose or palate. It has a lot of hay fever. There's lots and lots of catarrh, lots of mucus discharge. The mucus is often described as being sort of bluish. It's almost like this greenish, bluish color. It starts clear and copious, and then it turns into this greenish blue color. Arundo is the giant reed grass, and it's, just so you know that. The person who needs Arundo for their allergic state feels like they might suffocate from the nasal obstruction. So we call that hysterical dyspnea. So it's almost like they have this anxiety and fear that they won't be able to breathe properly, that their obstruction of the nose will be suffocative, and they do feel better near an open window. They have a strong sensitivity to environmental factors, and these are hay fever cases that are aggravated by urban pollution. Nasal discharge with this loss of sense of smell, annual periodicity, which is often the case for most hay fever cases. Upper respiratory conditions that tend to descend into the bronchi, maddening itching of the upper palate that extends to the ears. This is useful for allergic children who have difficulty sleeping during the night. They cry, but they don't want to be cuddled. They have nurturing issues. And we talked about these nurturing issues before. In this case, it's not about giving nurturing, about receiving the nurturing. If you're working with an allergy case in Wyethia, which is a very commonly used acute allergic remedy, comes up, Wyethia has this intense itching in the conjunctiva and at the roof of the palate. These are the people who rub their tongues very hard against their palate, trying to find some relief from the itching. Lots of itching in the nostrils, severe sneezing with deep itching in the nostrils. If Wyethia does not cure, I do recommend that you look at Arundo for possible relief. I'm going to quickly pop into the chat the name. Oh, excuse me. There's one more slide before I do that. Mentally, emotionally, Arundo does not want to talk or communicate during their allergies. They're unable to pay attention to anything about their discomfort. Their minds feel muddled and confused, and there's a lot of indifference. They laugh easily, which is sort of a strange, rare, and peculiar given that state of indifference. Before we move on, I'm going to type in a name of another remedy in the chat. It's called hold on, I can't talk and type at the same time. Give me 1 second. There we go. Phleum pratense. Phleum pratense is another remedy that I want you to keep in mind for the acute state. This is another one of these grass remedies to keep in mind for the acute state. Phleum pratense is Timothy grass. Timothy grass is one of the more popular or more commonly used grasses for hay. This is an incredibly useful remedy for hay fever with strong itching, not in the palate, in the nose, like we saw in Arundo, but strong itching in the ears. So it's a very, very useful all-purpose remedy for addressing all grass pollen allergies. I believe that at one time, Helios Pharmacy in England made a remedy called it's a combination grass pollen remedy, and it's a combination of these grasses, of these Powales remedies that can be, when all else fails, a very useful remedy to try for the acute hay fever picture. So moving on to the next remedy I want to talk to you about is Anthoxanthum odoratum, which is sweet vernal grass. This is a good remedy to try when other remedies fail in hay fever. We don't have a lot of information on this remedy, but it's been used medicinally and herbally for centuries. It has this allergic affinity with coryza, hay fever, spring allergies, but also skin allergies. It has allergic responses to insect bites, as if with a sensation that they've been pricked with needles. So this is going a little bit beyond the classic coryza rhinitis picture of allergy into something that in fact affects the skin, and in which insect bites is one of the causative factors. And mentally, emotionally, people who want this remedy, who need this remedy, tend to avoid relationships. And another remedy that I want to talk to you about that's very closely related to that is Anantheraum muriaticum, which is it's known as vetiver, which is a culinary and medicinal grass that's quite similar to lemongrass. This too has a very strong allergic picture. Allergy to grasses, but also a strong allergy to dog hair. Has this green nasal discharge, bad smelling, the discharge, copious discharge, lots of sneezing and cold air with an asthmatic cough. There's a lot of mouth ulcers and a lot of excoriation with this remedy. People needing this remedy tend to be competitive, controlling, jealous, unsociable, restless. They have disordered digestion and they tend to wake up at night in order to eat, and they have hunger immediately after eating. Saccharum is another one of the grasses that tends to have disordered digestion. So this is a theme, as do most of the triticum remedies. Those are the wheat remedies. They too can tend to have a lot of disordered digestion. Anantheraum has this monomaniac craving for a single food. They have skin disorders such as crusty herpetic eruptions, granular rashes, abscesses, suppurations, formication. That's that formication is that idea, that sensation of bugs crawling on you. And the mental emotional symptoms particular to Anantheraum is the feeling of being rejected by one's family and friends with envy of other family members. They feel ugly, but they want to stand out. And so they take on eccentric behaviors. They can be angry, they can be destructive. They're trying to draw attention to themselves. And they have a strong sexual drive with a lot of promiscuity. So you can see here that I'm describing a larger picture than just an allergy picture in Anantheraum. Anantheraum and the other grasses that we're going to be discussing moving forward are not grasses that I have personally used in an acute state, but used more in chronic pictures that also have allergy as a central part of that chronicity. Moving on to bambusa. Bambusa is bamboo. So the allergic part of bambusa is hay fever and allergies with copious secretion, lots and lots of sneezing. They have coryza with profuse discharge from the eyes, lots and lots of eye inflammation. The lids swell with nasal discharge. They have sleep problems. They tend to feel forsaken. They're clingy. They have a lot of neck and back pains, as if they're carrying the weight of the world on their shoulders. They have hormonal dysregulation in the estrogen progestin balance, and they're therefore worse before their menses. Mentally and emotionally, these are people who are overly responsible for the family. We talked earlier about this idea of lack of equality in relationships due to this strong sense of loyalty. People will stay in relationships even when they're working much too hard. And bambusa, the person will carry the familial burdens without complaint and with an apparent vigor and great. They appear very, very capable. They appear like there's not a problem in the world until they break. And at that point, things fall apart. They need support. They won't ask for it. This break often happens for women after giving birth. So they've been carrying the weight of the world, running everything, doing everything, and then giving birth is just too much from them. This remedy has issues that often result from too early of a separation from the mother, which is interesting because it seems to impact both the child and the mother, this separation of mother and child at the birth state. They have a lot of anxiety and an inability to cope with concerns about the future. I think there's more notes on Bambusa. Oh, no, there's not. The last thing I want to say to you about Bambusa is that there's a lot of back and neck pathology in this remedy. I always think of Bambusa as the remedy that as the grass that gives and gives. And if you can think of the image of bamboo swaying and bending, even when it looked, but still coming back up to that tall, strong, sturdy posture, and they're fine until they break. And a lot of that break can happen in the back and the neck pathology. So I want to talk to you next about the remedy Triticum vulgare, which is wheat. So this remedy in the picture, the allergy picture, has a lot of eye infections and allergies. There are hundreds and hundreds of rubrics about eyes, eye inflammation that have Triticum vulgare in them. There's a lot of agglutination, there's discharges, itching, there's pain, there's swelling of the eyelids, there's dryness, there's everything you can think of that we regard as an allergic reaction centered on the eyes can happen with this remedy. Hay fever symptoms that are located almost exclusively in the eyes respond well to Triticum vulgare. This is a remedy that has prominent digestive pathology. They have a swollen, painful stomach, food allergies, and the inability to digest wheat. They have sensitivity to dairy, to wheat, to fatty foods. There's obviously problems with metabolism, with undigested foods in the stool, and undernourished children are part of this picture. There's a sensation of gas, fullness, or emptiness. I want to add that this is the remedy that I have used for people who have wheat intolerance. And although you need to use it with great care and sensitivity, I have noticed that people with severe wheat intolerance also tend to have a large allergic picture. And when that is the case, I would think about this remedy. The mental emotional symptoms of Triticum vulgare are the desire to be with children or to have children, this feeling that they want one more baby. They need to become a mother once again. Not so much that there's a missing child, but that they want to become a mother. They want to perpetuate that nurturing state that we talked about earlier. There's a lot of anxiety concerning the family. They're very attached to the family with ailments from loss of family members. They care too much about the family and they forget about themselves. This is a very good remedy for women whose sole identity is defined by motherhood. It's ailments in children in which the mother thought that the child would die in utero. The child is clinging, need to have parents sleep with him or her. They're full of fears. And we talked earlier about issues arising for both mother and child at that point of separation, at that point of birth. Likewise, there's this ailment from being uprooted from the native country, the home. If you can think of a native country or home almost as sort of a metaphoric uterus, as a place where somebody's nurtured and developed, and then they're forcibly displaced or removed from that. You can understand this connection to this idea of issues for both mother and child after giving birth, and issues for somebody who has been forcibly removed from a place that felt was their home, was their place of security, their place of nurturing, their place where their roots were put down. What we see in Triticum vulgare as the development of pathology is this point of that they can't take care of home anymore. They're done. They're done doing chores. They're done taking care of other people. This is sort of one of these post-break situations. I'm not taking care of the home anymore. I'm not doing housework anymore. I need to separate from the family. I need to get rid of these duties and the demands of my family. This is one of these post-break situations. So again, this idea of imbalance is around family, around roots, and around identity. Okay, so I want to mention quickly this remedy called Cymbogogun citratus. Some of these are remedies that you're not going to be finding in your local homeopathic pharmacy, but you'll be able to get if you have patients who fit this description. This is known as citron grass. So there is a lot of nasal discharge that's bloody, yellow. It's worse for blowing the nose. There's a lot of crusting, scabs, painful inflammation of the tip of the nose. The eyes are agglutinated, worse in the morning. There's a lot of inflammation around the conjunctiva, the yellow discharge. You'll start to see that the itchiness and the eyes are not, it's a common pathology in these grasses, although we were looking at remedies earlier in which the itchiness is more in the ears or the nose. And prolonged sleepiness with Cymbogogun. Mental emotional symptoms are ailments from anger or vexation. They have a harshness to them. There's a lot of irritability toward children over trifles. Again, that harshness at play. Impatient, nervous, hasty, edgy. You can kind of feel that state. And then I want to mention the remedy Oryza sativa. Oryza sativa is just basic grass. So the nasal catarrh for this remedy is thin, it's runny, it's watery. There's a lot of snuffles, loss of smell. The throat is dry, it's full of catarrh, swallowing is difficult. They have to cough to clear their lungs. There's an asthmatic tendency with sort of like presents as allergic asthma. There's also a lot of allergic dermatitis in this remedy. So there's a strong affinity to the digestive system with difficult cravings and a limited diet. I think it's very interesting that oryza, which is rice, triticum, which is wheat, these are the remedies we're talking about, the ones that we're most familiar with as foods, and yet both of them have strong affinities to digestive system and digestive system dysregulation. The mental emotional symptoms in Oryza sativa are this idea of feeling like a slave, that they're doing all the work. And again, this is a remedy that this is a theme that we mentioned previously, particularly with the remedy Bambusa. They work with great skill, with delicacy, with attention to detail. They tend to be very artistic, and they work in small, careful detail. Family is very important in this remedy. The family has to stay together at all costs. But these are people who are very sensitive and they're easily upset by interference, by shock, by being overburdened, or sort of by a lack of equilibrium around them. And that wraps up the preparation, the prepared part of our presentation. But we have, I think, a good 15 minutes if you'd like to answer any questions. I hope you've come away from what we've presented to you today with a bit of a feel for a family of remedies that may be new for you, a feel for how these remedies can be used, certainly in chronic conditions in which allergy has a central role, but also in some instances, remedies that can be used in acute addressing of allergy situations. I would say that if you have a patient who is doing well with acutely with one of these grasses, that when the season of the allergy has passed and you want to turn your attention to more chronic addressing, that it would behoove you to give really careful attention to some of these grass remedies if the totality of symptoms suggests their use. Dr. Rashmika, do you want to monitor the questions?
Hello. Yeah, yes, definitely. I would love to. We have a good set of questions. People have been very, you know, into the webinar the entire time. They were asking questions. So many people have asked for notes.
Yes, and I
Sure.
just put our email address in there, info@ochm.ca. Whoever would like the notes, please email me directly.
Absolutely. As well, the whole webinar is being recorded, so it would be posted on the I Love Homeopathy page. And those who'd like to, rewatch the whole webinar or missed a part of webinar because they joined late or,
Sure.
the circumstances, you can always go and watch the webinar again. Um, notes. Dr. Sangeeta has asked, can wheat be thought for allergies, especially displaced refugees, especially in refugees type 4?
Absolutely. Absolutely. I mean, this whole idea of being uprooted, and, obviously that's exactly what refugees are. And if this is, I mean, I wouldn't just, you have a refugee who has allergies, I wouldn't automatically give them a wheat remedy. But if in taking their case, they talk about this sense, this feeling of being uprooted, how disturbed they are from being uprooted, this longing for laying down roots, for feeling connection, the disruption that being uprooted obviously has it's a massive disruption, and they have an allergic picture, I would absolutely try using this remedy for sure.
Um, what potency and repetition do you have experience of? I think this is a question which every
We always get
webinar
this
has.
question.
Yes.
It really depends. Potency is one of those things that is so hard to give a universal answer to. So if you're using something like Arundo or Fleum Praetense, in a more acute situation, we're largely talking about physical symptoms, and I would use 6s or 30s with frequent repetition, probably in water. If you're talking about a more chronic condition, I would focus on where the nexus of pathology lies. If the nexus of pathology is largely mental or emotional, I would work with a 200. If the nexus of pathology is largely delusional, I would work with a 1M. But even in a constitutional or chronic, if the nexus of pathology is physical, I would work with a 30. And I would start with I always start, particularly with chronic cases, with 1 or 2 remedies just to see if there's any response at all. Even the tiniest bit of response suggests that this is a good remedy. I am not a believer that a good remedy has to aggravate to show that it's useful if we go in very, very gently, but that requires a lot of careful attention and usage. LM remedies are wonderful for people who do have a lot of chronic conditions and who are needing a regular remedy. I would recommend that you use LMs and use the corresponding LMs to the CH potency.
A recent question. Are we correct thinking of spring allergies being due to tree pollen and summer allergies being due to grass pollen?
I think that depends on the individual, to be honest. And I wouldn't limit the use of these remedies to grasses. I think the point is that grasses are a source of allergy for a lot of people. I mean, just like think about pulsatilla. Pulsatilla is, a flower that comes out in the early spring, but it is also a acute remedy that's useful for allergies right throughout the season. So, yes, a lot of the pollens that are around early on in the year may not be grass pollens. You don't need to necessarily only use these remedies for allergies to grass pollens. I hope that answers that question.
Um, which would you give for the ADHD allergy link we had spoken about earlier? You had said about, you'd spoken about the tuberculomycin earlier.
Yes,
So yes.
yes.
So which remedy was the particular question? Yes. Carol Berry had asked, which would you give for the ADHD allergy link? Which is best for skin and digestion link?
You know what? Let Can we just share our notes for the person asking this question to go over all of these?
Yes,
I think
absolutely.
that's probably the best way to answer that, rather than to go through the recap.
Absolutely.
Bambusa is a great remedy for ADHD. A lot of they're all, you know, it's important for us to get beyond the idea of thinking one remedy, one pathology. The restlessness, the clinginess to family, to parents, the anxiety around nurturing issues, these are all aspects of some children's ADHD picture, but not all of them. But when that's the picture coupled with the appropriate religious picture, allergy picture, that's when we go into using these remedies.
Sangeeta has asked, does Bahola Labs have these poison? Yeah, I think we do have a few, like example, Bambusa or Xanthonum uraticum. We would definitely
Mm-hmm.
be having, but I will definitely check with the remedies which we have and then get back to you,
And
Sangeeta.
Triticum vulgare is not
Yes,
that hard to
triticum.
get. It is
Yes,
a
triticum.
really,
Yeah,
I mean, if you only have one or two Bambusa, Triticum saccharum, which we didn't talk about here,
Sakaram.
Oryza,
Oriza,
well,
yes.
there's a lot of them exactly that you would want to have at
Yes,
Arundo
yes,
for sure.
absolutely.
So, yeah.
Great. Anyone else? There's one more question saying, please show again the wheat slide with the explanation. I think that would answer the note part of it so that you can contact them and get the notes directly so that you'll be more,
Can you do
able to
that,
read
Harula?
some. Yeah.
Yeah. Oh, do you want me to share?
I see it now, I think. Yeah, the
Yeah, we
wheat,
can
the
actually share.
triticum.
Yeah, so there's a file box beside your chat box, so where you can add the file via Google Drive or Microsoft or a Dropbox.
Cool. Let me try. It's not doing anything for me. That's awfully strange.
Is this share screen still on?
No,
There we go.
Yeah, it's not letting me for some reason. I'm not sure why.
no issues. If you want, you could email me and I could share. I could try sharing it. That's also a
That would be
possibility.
great. That would
Sure.
be great. So, all right. Well, I think we should just say thank you then to everybody. We really appreciate your listening to us. We appreciate your thoughtful questions. We are very, very accessible and ready to, welcome any questions that you may have. Please email them to us. And we really do hope that this was useful for you. If you want to share some great cases, once you start using some of these remedies, we would love to hear about them. Harula?
Yeah, and I just wanted to let you know, Dr. Ramashna, I've just sent you the notes, so
Yeah,
you
great.
got them. Okay.
Great.
And thank you for the opportunity, and we look forward to our next webinar with you. We'll send you some
Absolutely. It's always a pleasure hosting.
links, and we'll.
Yeah. I haven't received the email, but I think I'll wait for a few more seconds to receive the email. Yes, I have received it.
We've got it now. Okay, wonderful. Okay. Well, thank you for
Okay.
sharing that with everybody then. That's much appreciated.
Thank you so much. Thank you so much. Please hold on. I will.
Okay.
Yes, great. The participants, please do hold on so that I can share the file.
Okay, have a great day. We'll talk to you
Thank you
soon.
so much. Yes, we
Our
will meet
Okay.
next
pleasure.
month with
Okay.
another, interesting topic.
Wonderful. Okay. All right. Bye-bye.
Bye.
Bye.
Have a great day. Hold on. I'm just trying to share the um, presentation notes in a few minutes. I am. Until then, if anyone's interested in presenting a webinar, wanting any other topics for the next webinar, please do comment on the chat box so that I will consider them and I will definitely get back with such topics. Okay, I'm extremely sorry. I am unable to share the notes via Zoom. There is some technical issue, but I will definitely type in my mail ID here. Please uh, share your mail address so that I can send the notes personally. I have typed in my mail ID there. I'm sorry. Yes, that's my mail ID. You can contact me via my mail ID and I will share the notes, the presentation personally. Thank you, Dr. Elspeth. I have noted your mail ID. I will definitely share the presentation with you soon. Okay. Uh, Thank you then. Thank you all for joining. Thank you for joining today, and we'll meet next time with a yet another interesting topic. Until then, thank you so much. Thank you so much. Bye. Have a nice day. Have a nice evening. Have a nice